All right, there's a couple of things I want to show you on this video. One, the pericardium, and two, the types of circulation within the heart. So let's talk about the pericardium first. When you look at a cadaveric specimen, you will notice when you cut the sternum is that there is a sac around the heart. So that's the pericardium. You cut that sac, then there's fluid, then you'll see the heart. So the pericardium serves to, the pericardium with the pericardial fluid serves to protect the heart. So it's something that the heart can kind of float in and move around in, and you'll find this in a few different organs. Your lungs have something called the pleura, and your abdomen has something called the peritoneum. In any event, when we talk about these, there's a parietal layer and a visceral layer. So just remember, visceral is always close to you, close to the organ. So the visceral pericardium is closer to the heart than the parietal pericardium. So we've got two layers of pericardium, and if you look at this slide in front of you, you'll see these two white lines. So let's start with this outer line. This outer line here, so we're not dealing with this fibrous pericardium right now. So this outer line here is called the parietal layer, and then you see a space here, and then you see the visceral layer. The visceral layer is actually covering the heart. So if you were to pick up a heart, you would be picking up the visceral layer of the pericardium. So there's a visceral layer and there's a parietal layer, and in between the two layers, you have pericardial fluid. And while we're on this slide, the visceral layer is also called, the other name for it, epicardium. Epi meaning like outside. So the epicardium, again, if you were to grab a heart and pick it up, you're going to be touching the epicardium, or you'd be touching the visceral layer of the serous pericardium, or the visceral layer of the pericardium. So we have the epicardium. This muscle, the bulk of it is called the myocardium, and that's labeled right here. And then the inner lining, so like the lining of a ventricle, for example, would be called the endocardium. So here's just another photo of it, and this is like the heart sitting within the pericardial fluid, and you see the parietal layer and the visceral layer. So let's talk about circulation. We've already gone over two types of circulation, systemic and pulmonary. So systemic circulation is when the heart feeds all the cells with oxygen, and then it's the return of that blood back to the heart through the superior and inferior vena cava. Pulmonary circulation is just from the heart to the lungs and back to the heart again. So out through the pulmonary trunk, which becomes the pulmonary arteries, back to the pulmonary veins. What we haven't discussed yet is coronary circulation. The heart has to give itself, or the heart has to give the myocardium, this layer right here. This is a muscle, and so just like any other muscle, it needs oxygen, and it has to get rid of waste. So it has to remove carbon dioxide. So it has a system that, it feeds itself oxygen. Now you would think, well, why doesn't it just siphon blood from inside the heart? It can siphon it from the ventricles or the atria, but it doesn't do that. So it sends the blood out of the heart first, through the aorta, and then off of the aorta, skip ahead, off of the aorta, you're going to see, so here's the aorta. This is the blood coming out of the left ventricle. It's going to come up here, and you can't see that obviously, but it's going to come up here, through the aortic valve, and then look, here's the one of the coronary arteries, the right one, and here's the left coronary artery right there. All right, so it comes out there, and then all of these are coronary vessels, and they're feeding the heart with oxygenated blood. So here's like another view of it. And so In fact, when you look at like the front, the anterior portion of a heart, you can see two what are called like a sulci or a sulcus. A sulcus is like a groove, and then like here you see two different coronary vessels. This one here is called interventricular. It's going in between the two ventricles. So I know there's one ventricle here, and there's another ventricle here. And then this one's called the coronary sulcus. So I know the atrium is above it, and the ventricles below it. It's kind of a way to figure out where things are in the heart. But anyway, these are two large coronary vessels that you can see. So again, there's the view. And so how this works is, so I'm going to show you in the next slide, is going to be kind of like a cross section. There's going to be kind of a cut right here. And if you were to make a transverse section right around, let's see, I'm going a little bit too high, right around here, I'm going to see all four valves kind of lined up. So I'm going to see the AV valve, like here's an AV valve, semilunar valve, AV valve, right? So, see, here's the aorta, here's the coronary arteries, here's the aorta, and right here is the aortic valve. So this is kind of the view looking down, or we're going, yeah. So we're going from superior down to inferior, right? And so here's the two AV valves. So we can forget about those for now. Here's the two semilunar valves. And really right now we're looking at this semilunar valve. And so what happens is that the blood is ejected from the left ventricle, and it goes through the aortic valve into the aorta, but then the ventricle relaxes. So that blood, when it leaves, so it goes through the aortic valve into the aorta, then when the ventricle relaxes, that blood wants to turn around and go back in. And it won't, because when it tries to go back in, that valve's going to close. So instead of going back in, it goes off to the side. So the blood tries to go back into the heart. It won't. It will not go back into the ventricle. And instead, some of that blood ends up in the right and the left coronary artery. So that's what's happening here. And so I put like a little circle here to be kind of like the opening of the right coronary artery here. And then you imagine like where this arrow is pointing, there's like another opening like right here. So the blood comes through here, it's coming up. And then when that valve closes, the blood cannot go back in here, back into the ventricle, because that aortic valve is blocking it. Instead, some of that blood's going this way, and some of that blood's going that way, and into these two coronary vessels. And those are going to feed the heart with oxygenated blood. This is the return. So these are all the coronary veins on their way back. So all these coronary veins, they all converge into the coronary sinus. You can't really see it because it's inside the heart, the coronary sinus, but the coronary sinus is going to empty into the, it's deoxygenated blood. So what side's it going on? Right side. And then the atria receive the blood, so it's going into the right atrium. So if you were to look inside of right atrium, you're going to see two holes which you could probably stick your finger in. You stick your finger down, you can stick your finger into the inferior vena cava, and then you can stick your finger like up into the superior vena cava. But then there's going to be like a little dot, kind of like on the inferior portion of the right atrium, and that'll be the opening for the coronary sinus. So coronary system is how the heart gives itself oxygenated blood. And this is kind of like an actual heart, so you can see it's not really color-coded, a little more difficult to see. So like you're actually not really, you can't really see vena cava here, but you can see this is the aorta, and then this is the pulmonary trunk going to the arteries. But you can see some of the coronary vessels here. And so this is where myocardial infarctions, heart attacks, this is where heart attacks would happen, right? You're not going to get a blood clot in here, or you're not going to get I mean, maybe, but I mean, it's not going to do anything. It's these little vessels that get clogged up with things, right? So you get this clogged with plaque, and this is what's going to be blocked. And then if that gets blocked, like right here at the tip of the pointer, then all of this area is not going to get oxygen, and those cells are going to be compromised. They're going to die, and they don't come back in the heart. So usually when you have MIs, it's some kind of coronary vessel. If you get it, let's go back to the coronary vessels. If you were to get your blockage here or here, one of these are called, or maybe both of them are called widowmakers, because if you get your blockage here, and I'm guessing here it's this one. So if you get your blockage here, all of this, so the whole front side of the and some of the back too of the heart is blocked. So you're blocking everything after it, and it's not getting oxygen. So that's going to do you in. You've messed up the left ventricle, and it's you're not going to get any ejection. You're not going to get any circulation, right? But if you were to get a heart attack, let's say like your blockage is like right there, right? Yeah, it's bad, right? But if I were to have a choice where I want something to be blocked, I want it blocked up in the atrium, that would be better, because most of the blood that goes into the atrium is going to just drop into the ventricles. Anyway, that's a different slide. So coronary circulation, the heart giving itself a supply of oxygen. So I'll stop there, and we'll do the next slide.